Welcome to the Health Deli, your local stop for a fresh take on community health topics. Come on in, grab a number, and let the guys behind the counter, Mark, Ben, and Mike, tell you about today's specials.
All right, welcome to the Health Deli. I'm your host today, Mark Young. I am joined with today with Mike Klepser and Ben Ponifract. How are you guys doing?
I'm doing great. You look great today, Mark.
Thank you. I couldn't even look at Mike without laughing, so I just have to focus on Ben.
My wife says the same thing. She can't look at me without laughing.
Yeah.
Anyway,
before we get into the topic
Awkward.
of the day,
Hi, Andrew. How are you?
Hi, guys. Welcome back to the show.
and I have to mention the beautiful Health Deli Studios here on the campus of Ferris State University, and it's a beautiful day outside too. So
it's very nice. It's gonna be like 60.
yeah.
My allergies are flaring up.
Yeah, those of you watching the video cast may see some of our fans come up to the window like normal. We have a lot of fans that do that. So
Yeah, is that your moving truck? Out there?
well, let's do some free samples. What have you guys been working on?
I've been working on my hygiene, brush my
No, you haven't.
Yeah, that's
No,
very
you mean
clearly a
sitting
lie.
next to
episodes.
you. And
Pathological
you're-
error there.
I'm working on an episode, questions from seniors. I want to know what's on the mind of some of the older individuals, and let them ask us some questions. And we're gonna.
Did you
try
ask
to
some of your
Grandkids.
friends at the nursing home?
ask my grandkids?
So I have been working on a couple things. Doing a deeper dive into some immunology, so seeing maybe the efficacy of like some immune shots, those kinds of things. Also an episode that I've been kind of toying back and forth with, and I know, Mike, you mentioned this a little while ago too, but spongiform diseases and like prion disorders.
Not SpongeBob diseases.
I would love to do an episode on SpongeBob. Can we do an episode on SpongeBob, Andrew?
Yeah, sure. What are you going to talk about? I can say SpongeBob.
We can get my son on here because he played SpongeBob in his High School
perfect.
Musical.
I can meet
That'd be
SpongeBob?
You could meet SpongeBob. I'll arrange that.
Oh my gosh.
That would be amazing. I would pay money to meet SpongeBob. I'm more of a
How much money are you willing to pay my son? He might still be in the building.
who's that like ornery, skinny
Squidward.
Squidward.
Oh my gosh.
That's great.
Really? You look more like Patrick.
Yeah, maybe.
Starfish.
Yeah, Patrick.
Live
I was
under a
thinking
rock.
Larry the Lobster. The
See, I
muscular
don't
guy.
know.
Hey, dudes, working on my guns.
In here, I feel more like the squirrel in scuba gear.
You're beating up, Mike. I gotcha.
Yeah.
Anyway, what are we talking about today,
Fish out of
Mark?
water.
Sandy.
So today is an episode that started out as weird and unknown body parts, and it morphed in, or weird and unknown body parts and functions, and then I had to trim it down just to body parts.
Because you had a lot of weird functions.
We're teasing out a whole nother episode
I
because there
know.
was so
'cause
much information.
You've got some weirdness going on with
So
your...
this is not an episode that has a ton of scientific information, to be honest.
My
It's
favorite
just-
type.
It's a lot of questions that I had, like what does that do? Why do we have that? Does that serve function or not?
I
You
can't
know?
wait.
One of the words we talk about is vestigial, which means is it or
Can
not?
can we say that?
Vestigial.
Oh, there. Hey, we forgot to bring in that. So, Andrew, you have fulfilled your "Can Andrew say a science word" today?
There's the first one down.
So, and that kind of means is it necessary? Is this part really necessary? To
Kind of like you
to your
guys.
function?
You guys are
not
vestigial.
necessary.
We're vestigible. Vestigible. Vestigilar.
Vegetables.
Right, you're unnecessary. So, all right, and then last episode, we started doing this thing kind of on a whim where Andrew has to say the hard medical words. So, Andrew, we're going to play a little bit of a game with this. All right, so before we say the word, which is a body part, you guys kind of have to guess where they are. Now, some will be very familiar to you, and you'll understand them, but you might not understand exactly.
Do we
what
have to
it
point
does.
to where the body part is?
Please don't. Please don't. Actually. And then we're going to talk about whether you really need it or not, and then what happens if something goes wrong with it. And then I threw in a fun fact about each of these.
Fun fact.
Most of them are not actually facts, but they're all fun. So,
Okay.
All right, Andrew. First word.
First word is uvula.
All right, so Ben.
I would also say uvula.
No. What does it do? I like that.
I thought we were playing a game here.
No, that is the correct pronunciation. That is the correct pronunciation. Uvula.
Okay. So what does it do?
Where is it?
Where is it? I think it's in the back of your throat.
Okay, Mike. Yeah. So this is a fairly, I mean,
But now
I
you have
think
to ask Mike what it
most
does.
listeners. But what does it do? That's the next thing. What does it do?
It serves as a landmark so I know how far to stick a throat swab in there to get a good specimen.
Right. You know, I thought sure that
Purely
you were going to
mechanical.
say it like somehow makes your voice, because you and I are of similar age. I hate to say that. But, you know, back in the day when you watched cartoons and they had like the singer with the wide open voice, they always showed the uvula moving back and forth like that was like some kind of like voice cord or something. That's not what it does. Actually, it has two functions. So it does have some serous glands in there that excrete saliva, but that's only a small part of its function. So it does actually secrete saliva when you swallow that would help to kind of lubricate that going down, that food going down your throat. So that's a small part of its function. Actually, a larger part of its anatomical function is when you swallow, it kind of lifts up and with your tonsils closes off your nasopharynx area. So it prevents, like if you kind of coughed halfway through, something like that.
Blowing milk out your nose.
Exactly. That's exactly
It
what
doesn't always work.
it does. Well, it's not perfect, but that's part of why it is. So, believe it or not, you can get an enlarged.
I don't believe it.
You can get an enlarged uvula, and it can be so enlarged that it will actually touch the back of the person's tongue. And become very noticeable. It may actually even give a gag reflex. And this can be caused by a few things, one of those being dehydration. So if you become quite dehydrated, that uvula, because of those serous glands, becomes inflamed, it becomes big, and then you have this gagging reflex because of that.
So is that why sometimes you'll feel like you have a frog in your throat kind of thing if you're feeling sick? Is that the uvula or is that a different
Probably not the
process?
uvula. It could be, but it's probably more your tonsils.
Gotcha.
Which we're actually going to talk about later.
Oh my gosh.
So first off, for all these body parts that are appropriate to do so, are we able to post pictures of some of these online?
Oh, we probably
Oh,
could.
look at that. Andrew's already on it.
Wow.
Is that an actual picture of your own uvula?
I just
uvula?
did. Yeah, I just did this.
I like that.
Wonder what wait till he tries to take pictures of some of these other things.
No.
Right.
I actually had a swollen uvula at one point when I was a teenager. So that's when I learned more about it.
So you can actually have a resection where they actually will shave some of that tissue off, or you can have a complete removal.
Is that a uvulasectomy?
So if you have that, well, it'd be a uvulectomy. Uvulectomy. Now, so part of the episode is, do you really need it? So you can live without your uvula. However, you are more likely to have food
Milk
get
come out
up
your
into
nose.
into your nasopharynx area, especially if you combine that with a tonsillectomy. So if you have a tonsillectomy and a uvulectomy, then you would have more of that regurgitation of stuff up into your.
Then you might need
That
a
sounds,
neti pot.
that sounds not fun.
It isn't fun. It isn't fun.
But then you could use your neti pot.
And then swallow it?
Wow. And as much as I love my neti pot, it's actually looking not so bad now. So fun fact, though, about the uvula, you may not think there's such a thing as a fun fact about a uvula.
I've never looked for facts about the uvula.
Yeah. So in some parts of Africa, the uvula, or some of it, at least a section of it, is ritually removed by a traditional healer without anesthesia.
For any particular reason or just
Because they can.
Yeah, I didn't get way into this, honestly, but it's done in childhood.
Hey, Andrew, could you find out why there's ritual uvula resections?
I don't think we want to open that box.
Probably not. Probably not.
Okay.
But that is interesting.
But I don't advocate that at all. So, all right. Let's move on to the next body part.
All right, the philtrum.
Good job. Now, this, if I had to guess, this will be the one that you guys might not be familiar with. So, Ben, philtrum.
I'm going to say it's in your leg at the back of your knee.
Okay. Mike.
I've got no clue, but I'm not going below the waist.
Okay, good. And it's not below the waist.
Oh, dang it.
It's actually that vertical groove between the base of the nose and your upper lip.
Oh, okay.
So that little indentation on your upper lip is your
Oh.
philtrum. So you might think, obviously, we don't need that.
Can I get a philtrum removal
Well, you could. You would have no.
or philtrum enhancement?
Well, maybe. So that could be. So the idea is that it's a holdover from increasing our nasal acute or our smell acuity. So if you look at a dog, we should have shown up a picture of a dog's nose. The philtrum is right between
There's a dog outside right now.
the nostrils. True. Okay. So, and it actually serves a very
Go
important
get the
purpose. That the dog, keeps its nose moist by licking on it. And that philtrum increases the surface area and it traps airborne
can't reach my
particles that then are able to be
weird.
dissolved and sensed by smell. So that it actually does have an evolutionary function in that it traps things there so that you can smell them better.
Interesting.
And
So
is that what your
that's
beard's
only
for?
What's that?
Isn't that what a beard's for?
It kind of serves a similar purpose, I guess.
I thought it
But-
was there because if you did your lip like this, it's a groove to put your nose in.
Nope, that's not it at all.
It was like a nose holder.
No.
Scientific reasoning from Mike over here.
But it has no actual purpose anymore in
Kind of like you guys.
Gotcha.
That joke never gets old, by the way.
Which joke is that?
It serves no purpose, kind of like you guys.
It is a classic.
But actually, the flattened philtrums or the absence of a philtrum may be the sign of certain disorders like fetal alcohol syndrome or Prader-Willi syndrome, which is a chromosomal disorder. It's a little bit like Down syndrome.
Okay.
So again, unlike the uvula, which does serve a real purpose nowadays, this maybe does not serve a...
Serves really no purpose, but it still maybe gives some look into kind of certain genetic disorders. There's actually a study. I'm going to say it was interesting. It was not well done, but they actually found a statistic association with the width of the philtrum and some other facial phenotypes and the incidence of autism. Now, that's not a scientific fact by any means, but there could be something there potentially. But
Okay.
I wouldn't go measuring your philtrum
Too late.
at all. All right. So, fun fact about the philtrum. In Jewish tradition, each embryo has an angel teaching it all the wisdom in the world in utero. And then the angel lightly taps the infant's upper lip before birth to prevent the infant from revealing the secrets of the universe. The infant then forgets the Torah it has been taught and must be retaught throughout its lifetime. And that's why I was there, touched by an angel.
So, I don't know if anyone here is an expert on the Torah, but that seems counterproductive.
I'm
They would
not an
explain all that
expert,
and then make you forget it.
but it's kind of, I don't know.
It's interesting.
Yeah, I guess.
What other way would they have to encourage their youth to learn the Torah again? You knew it once, learn it again.
You only have
How
to
could it be
relearn
so hard?
Yes.
True.
You just have to relearn it. You already knew it.
Yeah,
once.
yeah. It's already back there somewhere.
That's fair.
You know.
That's fair.
But if you were born without a philtrum, then you would have all that knowledge. And apparently, that didn't happen. I don't know. All right, next body part.
All right, didn't practice this one.
Good.
Lingual frenulum.
Really close. Lingual frenulum.
That was pretty close.
Ah, like a friend.
All right, so I'm going to go Mike first
In
on
the
this
lum.
one because we've been picking on Ben too much. Mike, what do you think it is?
All right. So I know that your body has frenulum in multiple places.
Yes, so frenulum is a more generic term. Yep,
Right. And that's just kind of like a fold of skin or something like that.
exactly right.
Lingual. I'd say like linguistics, that's in your mouth.
Yeah, you're there. You're there.
So tongue. There's something
Really
under your
close.
tongue.
Yes.
Getting warmer.
Yes. Ben?
It's under your tongue. I feel it.
Oh, yeah. Is that little like flap?
It's
that's
that
at the
little
bottom of your mouth?
flappy thing under your tongue. Now, why do you think it's there? And does it have to be?
It does not have to be there because sometimes that can get resected or clipped.
I'm going to say that it helps with secreting saliva.
So
Lock it in.
okay. So you both are a little bit right.
Am I more right though than that?
Now, so if the lingual frenulum gets severed completely or like injured, for whatever reason, if you take a hit to the mouth or something like that, you will probably have difficulty speaking and swallowing until that heals appropriately, or maybe for the rest of your life, even if it's bad enough.
So it kind of helps you control your tongue. Otherwise, you might swallow your tongue.
Right. It gives an anchor point. Otherwise, the tongue may fold over backward, but it kind of anchors the tongue down there. Now, there can be all sorts of things that happen with this lingual frenulum. One of those things is that it can develop canker spores on there, which can be quite painful. It can also develop other bumps or cysts. HPV can infect this
Human papillomavirus.
Yes, so it can have warts on there. HPV, of course,
Ben is.
risk factor.
Did we get the facial expressions that Ben just made on that?
No, I'm on with the camera now. Do that again.
Mouth warts.
Right.
Yeah, not fun, but
Not so good. Where you most see an issue with this lingual frenulum, though, is when it's actually too short, and it restricts the movement of the tongue. And this is known as tongue tie. There's this I'm even going to have trouble pronouncing, but ankylosing, or tongue tie. Insert foghorn leghorn. Yeah, Mike and I are talking. You know foghorn.
Oh yeah, I know foghorn. Yeah.
he's a giant chicken.
That's right.
Oh, good job, Ben. Oh, we're
can I
so
say?
proud.
Nice, good job. And what this leads to, and it's routinely screened when you're born. Basically, they routinely screen infants for this because without that frenulum, you have difficulty breastfeeding, so you don't get the right motion of the tongue. And then that can lead to poor weight gain and all sorts of other issues. Speech issues later in development as well, articulating certain letters, certain sounds. Even difficulty eating certain foods like an ice cream cone. So the act of licking the ice cream cone.
So this thing is
This is a
incredibly
tragedy.
useful then, yeah.
It is incredibly
Because
useful.
without it, you can't lick an ice cream cone.
Yeah.
So far, I don't want to lose any of these body parts, even if they can go away.
Right. You
Fair.
don't want to. So
Except this part. I don't know.
I like how mine looks though.
It's just difficult to shave around sometimes, and I cut it, and it gets, if you're blowing your nose a lot, it gets raw. I could
true.
do with, what's this thing again?
the
Filtrum?
Filtrum?
Yeah, it could be gone.
Yeah.
Yeah, I'm over it.
It's kind of gone already with the beard.
I'm
I can't see it.
evolutionarily over it.
Right. You're not smelling anything. It doesn't really help.
Heck
You
no.
don't want to smell most of the things that you do smell. Yeah. So then, of course, you can clip that a little bit if you do have tongue tie, and that would help with that. If you have pain in that area due to injury or whatever, maybe sucking on some ice cubes offers some relief. You can use over-the-counter oral numbing agents, things like that. So one other thing, if you have an absence of the lingual frenulum and the inferior labial frenulum, which is that flap on your under your upper lip.
okay.
If you have both of those things together, you have basically 100% chance of having a rare genetic disorder called Ehlers-Danlos syndrome.
I've heard of that before. Is that where you have like really stretchy,
Very stretchy skin and joints.
Yeah.
Yeah.
Okay.
So if you're lacking both of those frenulum from birth, you will have this Ehlers-Danlos syndrome. Kind of
Interesting.
Yeah.
So that mean everyone with Ehlers-Danlos syndrome have both of those
Yes.
missing?
Yes.
Okay.
Yeah. Now, fun fact, and this gets to what you said right off the bat about
Oh,
this.
about the saliva?
Yes, there's a hump of tissue at the base of the tongue that houses a series of saliva glands on either side of that frenulum. The two largest ducts are called Wharton's ducts, and they empty saliva into your mouth, under your tongue.
Okay.
And
Hold on.
there is... Uh-oh.
I want to
Yeah, I
take a
see
picture of him taking his picture. Go ahead, take your picture again. Got it.
Nice. And you can, if you open your mouth, you can actually see them under your tongue.
Yeah. Kind of gross.
And in some, it is gross.
Andrew's having a great time and
And
stuff.
in some people, those ducts are actually very active, and you can have saliva erupt out of them while you're talking. You may have seen this. I've seen this before. And that is a process known as, do you know
Is
the
this
term?
gleeking?
Gleeking.
Yes.
Yes.
Gleeking?
Yeah. So, for every 8th grader that's ever gleeked.
And some
that's
can
what that
gleek on
means.
command.
Yes.
So
I
you're
knew people
shooting
that could.
stuff out of your...
Yes.
You're like a
knew
lizard?
People that could shoot.
Kind of, yeah.
Shoot saliva out of those Wharton's ducts on command. Yes. I can't. I wish I could, though.
This sounds like something that you and your children should be able to do.
I can't. Maybe my kids could.
We need to do some training, I think. Training arc time. We all try to gleek at each other.
I'm not gleeking anybody.
No. So kind of, I don't know. I had the most fun with that one, I think.
You're,
All right.
you're such a gleek.
So we have time, I think, for a couple more at least, right? So next one.
Oh, the
Andrew.
appendix.
Appendix, right? So everyone knows what the appendix
Wow.
is.
Underhand.
For those listeners that may be unfamiliar, the appendix is this small, it's a finger-shaped tube about the size of your little finger that branches off the first part of the large intestine. It's been debated over the years over what it really does, and is it vestigial, where you don't need it, or do you need it? So, what do you think, Ben?
I know that it can be removed
Definitely.
and it's fine, but I actually don't know what it's used for. I know that there's like debate on whether it is completely useless or not, but I don't know.
I had mine removed, and then I had to put back because I missed it.
Wow.
You lie. There has never been a reattachment of an appendix ever.
There was no reason to remove it either. He was just like, I just want it out.
Wanted to see if I missed it.
Changed
I
his
did.
mind.
Yeah. So the appendix, you definitely can have it removed, but there is, since about 2005, there's actually been a fair amount of research into kind of really what does it do, why is it there, evolutionary, why is it there, and the most research suggests that the independence or the appendix serves as an important reservoir for gut bacteria. And so you got
Good
to follow me.
bacteria or bad bacteria?
Good bacteria.
Okay.
So this is the theory, and it's definitely a theory, is that you could have dysentery or cholera, some kind of bad infection, and you'd have massive amounts of diarrhea, vomiting, whatever it is, and you would basically, your gut would be devoid of healthy bacteria because of that. And then the appendix, because it has this little cache of bacteria, could repopulate the gut flora with beneficial bacteria.
So it's like sourdough bread. And this
little
is
bit,
your
yeah.
starter thing. So
Dude, I
then
love
the appendix
sourdough
is your
bread.
little sourdough thingy.
Right.
Yeah.
So we've talked a little bit about C. diff in previous episodes and how that's when bad bacteria gets into your GI tract. So we got rid of all your good bacteria. I wonder if the appendix should be something we should be looking into.
I saw one study that actually studied it. And it was a very small study, and they looked at people who had C. diff, and then they looked at those people, and don't quote me on the actual numbers. I want to say it was less than 150 people though.
Okay.
And then they basically just said, do you or do you not have an appendix? And comparing that group to the normal population, a percentage of people that have an appendix, 4 times as likely to have C. diff if you did not have an appendix. Now, you couldn't, statistically draw much conclusion from that, but there may be an association with an increased risk of C. diff and not having an appendix because you don't have that little seed bank there to reseed the gut.
Wow.
Kind of interesting.
Yeah, that is
Because
super interesting.
I learned in anatomy in the late 1990s that it had no function. In cadaver lab, we looked at it and felt an appendix, and I just remember vividly saying, yeah, you don't need that thing.
And they would tell you something like, yeah, this is like when the caveman thing.
Right,
And so you don't need it. It's kind of like your tail, at the bottom of your, spine, there's a coccyx. That's when you had a tail. I would like to see you with a tail.
Yeah, no, you would not. But if I don't want to say like that people should say, oh, I don't want my appendix removed because. So if you have an appendicitis,
Those buggers can rupture.
it can rupture. It is a medical emergency.
Yeah, it can be life-threatening.
Right, you're going to have terrible
Pain.
abdominal pain. It's going to move to your lower right quadrant, and that requires surgical removal. That's really the only treatment. So, if your appendix does rupture, you can imagine you're going to have your intestinal contents spilled into your gut. Not good.
Yeah.
No, never sounds good.
No, bad.
Spilling your guts. Not
Fun
good.
fact. Fun fact. In 1735, so
I was 42.
Mike was just a little guy back then.
Yeah, 42.
Dr. Claudius Imiand performed the world's first appendectomy at St. George's Hospital in London. An 11-year-old boy, the appendix had actually been perforated by a pin that he'd swallowed. The first successful operation to acute appendicitis, so that inflammation, was in 1759. The fun fact, though, general anesthesia was not invented until 1846. So these patients were restrained by assistants while they operated on them.
That
my
sounds
goodness.
awful.
Yeah.
For like everyone involved.
Could you imagine?
They
And
didn't have
did that
local.
for 100 years.
Did they not have local? Or I
No.
mean, could they do nothing?
They had a mallet.
Yeah, they used to give
They
people
couldn't-
alcohol.
Yeah, do that or
I mean, probably alcohol.
knock them
Yeah,
out.
take a
I
sip
mean, they
of
probably
this.
did, but you're like still in crazy pain. You're like thrashing, like
Yeah.
ugh.
Awful.
Could you imagine being the surgeon in that case? Like being a surgeon, you have to be very precise. Like,
Oh,
and
yeah.
someone's thrashing her.
Oh yeah, back in
Oof.
those days, yeah, not so much.
Not good. Well, on that note, let's take a pause for the Healthy Minute.
Oh, that sounds lovely.
Let's pause for the Healthy Minute, brought to you by the winery at Young Farms. Today's Healthy Minute is wear sunscreen. Sunscreen isn't just a cosmetic product. It's a powerful shield against the harmful effects of ultraviolet or UV rays from the sun. Prolonged exposure to these rays can lead to premature aging, sunburn, and more importantly, an increased risk of skin cancer. By applying sunscreen regularly, you create a protective barrier that helps prevent sunburn, reduces the risk of skin cancer, and minimizes the development of fine lines and wrinkles. Sunscreen is a simple yet effective way to prioritize your long-term skin health. Whether you're heading to the beach, going for a walk, or simply spending time outdoors, make sunscreen application a non-negotiable part of your routine. Look for a broad-spectrum sunscreen with at least SPF 30, and don't forget to reapply it every 2 hours, especially if you're swimming or sweating. Remember, caring for your skin today is an investment in a healthier future. Let's make sun protection a habit and ensure our skin stays protected against the sun's potentially harmful effects. That was the Healthy Minute, brought to you by the winery at Young Farms in Mecosta, Michigan. Please visit www.thewineryatyoungfarms.com for more information. Now, back to the Health Deli.
Boom, chicka, boom, healthy, 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 healthy.
Beautiful.
Thank you.
I just don't go outside.
That's probably best for everyone.
How'd you get here, Mike?
Just
I
in public in
teleported
general.
myself.
I was thinking like tunnels.
That would be incredible if there was a series of tunnels to keep us from going outside and seeing the sun.
That would not
everywhere.
be- That would be awful.
Everywhere.
I think that's an apocalyptic movie that I watched once.
I call that the best day ever.
All right, Andrew, what is our next body part?
All right, I'm going to take a cue from some of the other words we've been saying with these letters in them. So the lunule, sorry,
No.
Yeah, let's just say wrong.
lunula.
Yes.
Lunula.
That's very good. Lunula.
Yes.
Unula.
Unionula?
Lunula.
Lunula.
Now I'm saying it too many.
Lunula.
Yes. Ben, what do you think that is?
So have you guys seen the commercials for that Lumi stuff where you put it like on your armpits and it makes it not smell?
Yeah, I actually have.
So
No.
Mike
based,
hasn't, obviously.
yeah, I can. That's why I brought it up actually. So you're supposed to put that on your armpits. So I'm going to guess that they came up with that name based off of this. And I'm going to say it's a gland in your armpit.
Okay.
So
Logical.
loon makes me think of moon. So it's something that is moon shaped. I have no clue where.
What's
So that is
Your
great. You know,
fingernail.
I'm thinking,
It's like crescent.
Oh,
so eula usually means something small.
small
So
moon.
I wonder if that actually is probably how it was named. I'm putting this all together. That was actually a really good observation. So lunula is that crescent-shaped whitish area at your fingernail base. So you are correct.
Crescent.
Yeah, kind of that half moon kind of looking shape. So
Okay.
moon. Yeah, that's what it is. Now, do you know what it does though? Does it have a purpose? Does it not?
So is that where your
Is it
like
cosmetic?
fingernails like grow out from? Are they like a different kind of cell? Something like that maybe?
Isn't that the cuticle? What's the difference?
So the cuticle would be just that area where the skin meets the nail.
Okay.
So same area.
Okay.
So the nail bed is what generates
The nail bed
There's
matrix,
underneath the
yep.
fold. There's the matrix and nail bed, and that's where the nail grows from.
Mm-hmm.
I don't know what this crazy weird color thing is.
So
I'm
it
gonna
has
stare at
it
it.
kind of has two purposes.
I
One,
don't have one on that finger.
yeah, because you have a Band-Aid on it.
No, this finger.
Oh, so we'll talk about whether or not that means anything.
Am I gonna die?
its major role though is actually a protective barrier. It's kind of like an insurance policy. So if you as
This little
terrible
piggy's
as
not
this
insured.
sounds, well, if it no, it is. It's under there. You just can't see it. As terrible as this sounds, if I tore Mike's fingernail off right now,
Stop.
the lunella would actually appear like a mini fingernail, and it has a protective effect of that nail matrix. So it's like another shield, keeping that safe. So that's why it looks like that. Now, even if you can't see yours, if the skin is grown up where you can't see it, it's there. It's just not as apparent, right? It also sets the edge, the leading edge of your nail plate, which is actually your nail. So it's kind of interesting. I probably should have saved this for the fun fact. But if you look closely at your lunella, its shape will be almost exactly the shape of if you don't trim your fingernails, it'll be almost that same shape.
Oh, really?
And if you have an abnormality, like if you hit yourself with a hammer and you have an abnormality, like a little bump, it will translate into a bump on your nail as well.
Okay.
Kind of interesting.
Yeah. So I actually lost I think it was my thumbnail when I was a kid because I was playing baseball and I got crushed between the ball and the bat. I wasn't very good at baseball.
Apparently.
But yeah, I forget which thumb it was, but there's probably something there.
So, next question. Do you need it?
I mean, it serves a purpose. I don't think it's like life affirming or anything.
You
but
only need it if you want fingernails.
I do want fingernails.
So you need it.
Do you really?
So if you had an injury to the lunella, hard enough where the lunella was removed, then you would not have a fingernail.
Really?
Yeah, so now if you had an injury slightly less than that, where you lost the nail plate or the nail, but it didn't get into the lunella and the lunella did its job, kind of protected it, then you would regenerate a nail.
That's probably what happened
But
to
if
me.
it was hard enough where you actually removed also the lunella, you wouldn't have another full nail. You might have pieces of a nail.
So now my mind goes to, do I need my fingernails? Because I'm assuming they're left over from claws to help with digging and fighting and stuff like that. So could this all just be done away with just no fingernails? Because think of all the grooming
you
that.
need 'em.
Why?
How
To
are you going to pick
scratch?
your nose?
Yeah, good point.
I don't know. I mean,
That's all I needed to say.
I
open
feel
little-
like I need my
Open little doors to put SD cards and video production equipment.
Yeah. Except for they have those ones that you can just push and they come out now.
That's
though,
nice,
so
but then those aren't protected so much. It depends on the equipment, right?
Yeah, come on, Ben. Know your equipment. Well, jeez, it's kind of embarrassing sometimes.
now.
Right, Andrew?
Yeah. Come on, Ben.
do you even know what a USB is, Mike? Nope.
Actually, no.
Universal
Is it
serial
USB?
bus.
No, it's Bluetooth is the one for the Norwegian prince or whatever. That's where the symbol came from.
Oh yeah,
believe
didn't we
you, I
talk about
guess.
this?
I don't know.
I felt like we talked about this.
Wow.
Now,
Anyway,
getting back to the
What are we talking about?
lanula. Getting back to the lanula, there's two things that can happen. You can have an enlarged or the absence of, right? So at least not being able to see it. So if you have an enlarged, a macro lanula, there's actually two that can be a marker of a couple different problems. There are two particular variants. One is called Lindsay's or half and half nails. And that's where basically the entire nail, or not the entire, half of the nail is the lanula. So it's very apparent.
it's not like side by side half. It's like, you mean like from
It
bottom
looks
to top
like
half?
it takes up about half of the real estate of your nail instead of just a little bit at the bottom.
Okay.
And actually that is common in kidney dysfunction. So people in late stages of kidney dysfunction can develop that. Not 100% of the time, but it can happen.
Interesting.
And then Terry's nails, and I am not familiar with this at all, but Terry's nails can be a sign of liver disease. And that is an even more apparent lanula, where it is pretty much taking up the entire nail. And it can be a little bit hard to see because it just looks like
That's what your nail
a
looks like.
whiter nail.
Huh.
So it's kind of interesting if you get on the internet and look at pictures of it. Kind of
So like someone with cirrhosis or like end-stage liver disease, or is what you're talking about?
Yeah, it can even happen with adult onset diabetes sometimes.
Oh,
Yeah.
interesting. Yeah, I've never heard of any of this.
No, and I've never really paid much attention to it, to be honest, but it can happen. Now, on the other side of the spectrum, where you don't see it, where you can't see your lanula, That can also happen with heart disease, thyroid, but it's really not very indicative of anything. Most people, I wouldn't say most people, there's a lot of people out there that can't see them. It doesn't really mean anything. There are some disorders where it becomes a different color, and that's called azure lunula, where they take on like a blue discoloration. And that's indicative of Wilson's disease, where you can't metabolize copper, so you have this buildup of copper. But one of the first things that you may notice is a discoloration of that. Kinda
Okay.
weird.
Yeah.
I don't know. Interesting.
Having blue fingernails.
Yeah. And fun fact, there's a belief among many on the internet and the interwebs, when I was researching this, that a larger and more pronounced lunula is a sign of genius. That is not rooted in fact at all. Zero.
So is that why mics are so small?
Yeah, maybe. Yeah, you can't see them. So supposedly,
said
if you
that.
have a more apparent, you're smarter. I don't know.
Wow.
I can only see them on my
Yeah,
thumbs.
so this obviously has been debunked. Just at
This is
this
not
table.
at all. This is not at all.
I mean, just at this table, we've realized that this is just so far fetched.
I don't know. I think you're onto something here.
But I tell you what, if you look at the internet, there's a lot of people debating and having like,
So this is what we should
is
do
on
at some point in time.
Reddit.com.
We should start a theory on the internet and see
just
how
let it-
viral we
let it
can let it go.
yeah.
I think it depends on where you put it. I could find us some good spots to put it.
Yeah. All right. Well, I think we have room. I think we have time for one more.
Yeah, we're gonna skip to the last one. Just kidding. All
Do
right.
you want to?
I want to skip to the last
No,
one.
no, let's start with the tonsils.
No,
Let's try to fit two in
tonsils.
here. Let's fit two in here.
Okay, we'll go fast.
Tonsils.
We'll go fast.
Tonsils.
In your throat.
Everybody knows where your tonsils
Yes.
are. Technically, they're called the palatine tonsils because tonsils is a little bit more of a generic. Like your adenoid is also a tonsil. It's a little bit farther back. What do they do though? Why are they there?
So I am not entirely sure on this, but I believe I've heard somewhere that it actually helps with your immune system. So you like have lymph and stuff that goes through your tonsils, and so like that's where some of your white blood cells live. That
So
kind of thing.
technically, you could consider a tonsil a lymph node, actually.
Okay.
So it is immune response. The idea is that it's kind of your, maybe not your first barrier, but one of your first barriers to upper respiratory illness would be your tonsils. Moving along, the problem is in that some people, those tonsils themselves will become infected and actually deteriorate into this thing called a cryptic tonsil, where you have like pockets in your tonsils. And then, of course, they would have to be removed. So do you need them? No, you can definitely live without your tonsil. But it does offer an extra layer of immune protection against upper respiratory illness.
Yeah, I'd be interested. Are there any studies that you saw of like rates of upper respiratory
No,
illness?
I didn't. No. One interesting thing though, and I knew a little bit about this before, but I got a little bit more information for this episode, are these things called tonsil stones. And they're more, so they're more common than I thought. 10% of people in the United States experience tonsil stones. A large tonsil stone, fun fact, can be as big as your pinky fingernail.
Yikes.
So very big. Yeah.
Yeah.
Yeah, and you've got freakishly large hands, so those would be
know.
big.
Big tonsil
Yeah.
stones.
Wow. As
and
big as Ben's head.
They're most often associated really with bad breath. But they can turn into more serious situations and actually require surgical removal.
The stones, you mean?
The stones. Yeah.
They can also be irritating and cause some discomfort and pain.
Yeah. People, I have not experienced this, I don't think, but they report like a foreign body feeling. Like it just doesn't feel. Oh, have you had one?
Yeah, I've had them before, and my wife gets them even more than I do. But she'll eventually just cough them up, or she'll feel them come out, and then usually it's associated with a sore throat. She'll have a little sore throat, and then all of a sudden it's gone. Because it's come
Coughed
out.
it
Yeah.
Yep. And there is gargling with salt water may help loosen those. Sneezing, coughing, and actually yelling also sometimes will dislodge those as well. And another great internet thing, if you're really bored, is some people advocate making this certain sound when you yell
Oh,
to
well.
get the right amount of vibration to dislodge them. Hilarious.
Oh my
The
gosh.
right frequency.
The right frequency.
The tonsil stone
that's
frequency.
That's like a television.
So are the stones like calcium stones or like?
So
what are
great
they?
question. So it does become like a mineral matrix, and it actually becomes a hardened stone. So it could start out as some like food deposit or something like that, and then because your tonsil kind of surrounds it and concentrates it, it becomes hard like a stone. It has a lot of methyl mercaptans in it. So from the wine industry, mercaptans offer a lot of flavor and a lot of smell, and that's why they smell awful.
Interesting.
Yeah, just
Okay.
terrible.
Could you collect them and make jewelry?
You probably could.
Okay.
Yeah.
Let's not do that.
Okay.
Do that. All right, last one. And I'm not going to make Andrew say it, but
I wanna
he probably
hear him say
wants to say it. All right.
Well,
He already has said it.
Why do males have nipples?
So great question. It's obvious where our nipples are. But
Andrew's taking a picture of him right now.
This is an example. Yeah. No, please don't.
Not doing
Please
that.
don't. This is an example of a truly vestigial organ. It offers no purpose for human
What are you going
males.
to pierce if you don't have your nipple?
Well,
That's a
nothing.
great question. That's a great question, Mike. Asking the real questions.
But I had to look into this of why, like all this evolution, why are they still there? Why do they exist? And actually, it's because that in utero, when we are forming, one of those first things that happen is the nipples are formed on our bodies before our sex is assigned. So they're just kind of a leftover from that. So the
Is it kind of like a minivan where you've got those places where they could have added extra functions and buttons, but then they just
it is,
And then they just don't.
yeah,
Did he just say a male nipple was like a minivan?
kind of like a minivan.
So we're like the lower version,
Like a low
model,
version
and
of
then
a minivan.
females are
Hey,
the
Andrew,
XLT.
did you drive your male nipple to work today?
Nice. But I also want to say,
Yeah,
though,
because I drive a Kia.
right.
I also drive a Kia.
I do want to say that all men, they'll also have a small amount of breast tissue behind that nipple. And that breast tissue can become infected. It is rare, and even rarer, males can develop breast cancer. So I want to
Refer to
remove
episode number.
those two things. Yeah, exactly.
Mike's
So,
story.
so that can happen. But the nipple itself, completely unnecessary for men.
I wish we would not have ended with this. It just
no.
leaves a bad
We
taste in
gotta
my
end.
mouth.
We have to end with the fun fact, though.
Oh, dear God.
5% of the population has a supernumerary or third nipple. They most often mistake this smaller nipple for a mole. And it's more common in males, and it always appears on a line from the upper armpit down to the hip.
You mean, eh?
Yep, right on this line. You know why I know that? Dun, dun, dun. I have 3 nipples.
Oh my God. Is this real?
Yeah, it is.
Andrew
Now,
wants a
Chad, is
picture.
this real?
Andrew wants a
I
picture.
didn't. No, wait. I didn't know this until I was almost 30 years old.
No, you knew it before
So
that.
I went to the dermatologist because I thought I had a mole. It looks suspicious. And he looked at it, and he says, "I'm pretty sure that's a third nipple." I said, "Really?" He goes, "Keep an eye on it," but he said, "You really can't tell. It looks exactly like a mole. It doesn't resemble a nipple at all." So I may not too, but
This is a story you told when you were on rotation as a student that you had a third nipple.
maybe it was no.
No, I remember you
I feel
sharing.
like I was much older.
And then I go, why did this dude keep sharing stuff like he's got a third nipple with me?
It's interesting though. I think it's interesting. I must have been more like 20 then. I thought I was much older, but
Oh,
I
no.
do remember it.
I remember 2 things about you as a student. You had a purple bus and a
did
third
have a-
nipple.
Yeah, I was so much cooler back then. All right, I think it's time to wrap it up. Let's hang up the sign. Until next time from the Health Deli. Thanks for stopping by the Health Deli to sample some of our wares. We're open 24/7 on Facebook and Twitter at The Health Deli, or visit thehealthdeli.com to send us a question or find any of our locations. Please come again. We will be regularly stocking the shelves with fresh content and new wellness specials. As always, we want to give a special thank you to Andrew Tingley and the crew at Ferris State University's Television and Digital Media Production Program. Until next time, so long from the Health Deli, where the topics are tasty, the takes are fresh, and the discussion is free. All right, well, on that note, I think we should sign off. Let's hang up the sign. Let's jump on the purple bus.
Keep your shirt on, dude.
Hop on the third nipple.
There you go.
No. Dear God. Why did you say that?
Alternate ending.
Do not end
Do it one more time. Just
What?
I like it.
All right.